All right. Hi, everybody. On behalf of Chase, welcome to our pandemic nutrition panel. We have Desta Golden, naturopathic physician and LFCC adjunct, who teaches HLT 230, our nutrition and human development course at the college, joining us, and Stacy Haga. And I hopefully I said that right, Stacy. I always wanted to say it the wrong way, but hopefully that one's the right way. um, so Stacy is a registered dietitian with her own nutrition consulting practice, and works with individuals and groups in nutrition and food sensitivities and that sort of thing. So we are just going to hand it over to both of them. Desta is going to present, Stacy, and then we'll open it up for questions and discussion.
All right. Thank you, Stacy. Let me share my screen. All right. You guys see what I got going on now? Oh boy. Okay, great. So, as you guys saw from the posting and the announcement and invitation, we're going to be talking a little bit about nutrition support during this very special time, this pandemic, as it relates to COVID-19 and coronavirus. Like Stacey said, I'm Dr. Desta Golden, and I just am going to talk a little bit generally about the things that you can do with nutrition and nutrients and food to support yourself, not only to prevent COVID, but also to prevent COVID severity if you were to become infected. You can see here's my contact information if anyone wants to chat later. Let's see if I can get this to move. Okay. So I want to kind of lay the foundation with kind of this statement. What you do every day matters far more than what you do every once in a while. And that is especially true when it comes to food and when it comes to diet. Taking a supplement every once in a while or eating broccoli every couple months or whatever is not nearly as effective as doing things more consistently every day, ideally. And so it's really kind of important, not only with coronavirus and COVID, but just in general to prevent any lifestyle diseases, heart disease, cancer, diabetes, those types of things. It's going to matter the choices that you make every day are going to have a far greater impact than the choices that you make every once in a while. And that's true both for the positive things and eating healthy foods and for the negative things and choosing foods that don't support your body quite as much. I want to talk about a couple specific nutrients that have kind of had hot research on them in the last year or so in terms of their ability to regulate and support the immune system and kind of mitigate the effects of COVID-19. And you can see kind of here's a list: N-Acetylcysteine and glutathione, vitamin C, vitamin D, zinc, and resveratrol. And so let's go through those. The first one is N-Acetylcysteine and glutathione. N-Acetylcysteine is an amino acid, and it is a precursor to the compound glutathione, which is a huge, super antioxidant in your body. It is in charge of kind of mopping up all the messes that your body makes just in the in the process of metabolism, just your body doing its everyday job. It creates waste products, right? That's why we, have to go to the bathroom. And so N-acetylcysteine is a precursor, and your body converts it into glutathione. And you can see in COVID-19 specifically why it matters here. N-acetylcysteine is really good for thinning mucus, which can make things difficult to breathe if you have really thick mucus building up, right? And so that's going to be a big problem if someone were to become infected. Antioxidant capacity is also really important in COVID-19. And like I said, glutathione is kind of like the master antioxidant in your body. And there's also been a lot of research in glutathione specifically when it comes to COVID. And you can kind of see here some of the positive outcomes in those studies: reduction in inpatient hospitalization, reduction in need for meds. Sorry, can you, if that's in your way, sorry. Um, Reduction in need for ventilators. So that's a huge positive right there. Reduction in need for oxygen, supplemental oxygen, a more rapid recovery, and fewer morbidities, because that's the thing that we're really running into a lot now is people are recovering from COVID, but then struggling in the long term, right? Calling it long COVID or whatever. And so we want to make sure that we are also mitigating those side effects as much as possible as well. Okay, so we know why glutathione matters and why it's important. So let's talk about where we find it. The reason why I kind of coupled N-acetylcysteine and glutathione together is because glutathione, you can find it in foods, but dietary glutathione is not really well absorbed. And so kind of your best bet to get the most glutathione at the end of the day is to go the N-acetylcysteine route and eat more of that. And so that you have more building blocks for your body to make its own glutathione, because that's kind of what it's better at doing. Um, And the ways that you can do that, like I said, N-acetylcysteine is an amino acid. And so anything that has protein in it is going to be a potential source of N-acetylcysteine. The other thing that you want to think about is you can see, hopefully you can see, I don't know if you can see this Zoom thing. This is the structure of glutathione, and you see what kind of makes it special is this sulfur compound right here. And so making sure that you have, again, all the building blocks to create it is going to be important. So eating sulfur rich foods is going to be really helpful in terms of helping your body create glutathione. You can kind of see here some of our top sulfur rich foods. Other things that are going to help you increase glutathione in your body is curcumin, which is one of the active constituents in turmeric that helps you increase glutathione. The thing about this is that curcumin is really the key here. And so in order to get enough of that extract, you almost have to take a supplemental form, but even, every little bit helps, right? So dietary turmeric is going to be helpful as well. The thing that you want to avoid is going to be alcohol, or really limit alcohol. Studies show that drinking alcohol regularly decreases glutathione production, especially in the lungs, which is going to be important when we're talking about COVID, right? By 80 to 90%. So that's huge, right? So limiting alcohol is almost going to be just as important as making sure that you're doing the things that help produce glutathione. I included in each of these where to find it slides a recipe that might be especially helpful for that particular nutrient. And here we have red lentil and cauliflower curry. So you can see lentils are going to be a high sulfur source. Just like cauliflower is one of our cruciferous vegetables. A curry is going to contain that turmeric with the curcuminoids. So that's going to be a great, and I'll have Stacy send this out to all of you. These are linkable, and so you can get right to the recipes. All right, our next nutrient is going to be vitamin C. Vitamin C has tons of research on it in COVID, and you can kind of see here all the kind of pots it has its hands in. It has an indirect antiviral effect. Obviously, when we're talking about preventing or mitigating viral effects, antiviral is going to be the way to go, right? It helps to increase immune function so that if you are to come in contact with a virus, your immune system will be better able to handle it. Again, this similar to glutathione, it's going to decrease your need for a ventilator. It's going to decrease your stay in the ICU. It's going to support your blood vessels, which is going to be really important. It's also kind of has our antioxidant capacity and anti-inflammatory effects as well. And that's going to be important because when we talk about, we've all kind of heard the phrase cytokine storm when it comes to COVID. That's what's going to limit that kind of hot mess of cytokines, is that anti-inflammatory effect. Oh gosh. Let me, I got this over my arrow and I can't see. Okay. Oh. Here we go. So where to find it? Vitamin C. We have some top foods of vitamin C. Usually in my classes, we talk about this all the time, and I have my students kind of guess, and everyone always says oranges, right? And that's cool because oranges do have plenty of vitamin C, but there's a lot of foods that have even more vitamin C, like strawberries or bell peppers. Yellow bell peppers, especially, have the most vitamin C, and things like guava and kiwi also have tons of vitamin C. And so there's a lot of opportunities with a lot of foods that are pretty well liked to get plenty of vitamin C. And a great way to get vitamin C in terms of a full meal is going to be something like a stir fry, because you see you have all these bell peppers, you have the snow peas, you can include the broccoli, you can include kale if you want to. Um, and so there's lots of opportunity to get vitamin C in something that's super easy and simple to just kind of whip up like a stir fry. All right. Our next nutrient is vitamin D. And this is, I don't know, can you have favorite vitamins? Maybe vitamin D is probably one of my favorite vitamins. Um, just because it has its hand in a lot of pots, and it does so much for our body in so many different areas, from regulating insulin resistance and glucose balance, to protecting our heart, to supporting our immune system, to keeping our bones healthy. Lots of, you know, all around positives here. Why it matters when it comes to COVID is, again, it's going to have this anti-inflammatory action to kind of prevent that cytokine storm that gets people into trouble with COVID. It also provides kind of a physical barrier. It inhibits the virus from attaching to receptors and getting into your body in the first place. So that's great, right? That's kind of our first line of defense. Is if you come in contact with the virus, we want our body to do everything possible to keep it out, like a shield. And vitamin D kind of operates like that. The thing about vitamin D is it's kind of a special vitamin because our body can produce all that we need on our own. The trick is that we need to be exposed to sunlight and UV rays. That can get a little bit tricky, especially in the winter when it's cold and when the earth is at such a tilt that our latitude makes it tricky to get enough UV. Um, and when you compare that, and when you compound that with the cold, and nobody's really going outside, especially going outside with skin exposed. If you are going outside, you're probably bundled in a coat and all that, right? So especially during the winter months, it can be tricky to get sunlight. During the summer, kind of go whole hog. The thing about summer is that people are often wearing sunscreen, right? And that's going to block UV rays, to prevent things like skin cancer. But we do need a little bit of those UVs to get through in order to produce vitamin D. In terms of food, things like fatty fish and mushrooms are going to be uh, reasonable sources of vitamin D. Things like fortified milks, vitamin D is added to most milks to make sure that people are getting enough. Obviously, there's supplements. Vitamin D is one of those vitamins that most people are insufficient in, and aren't getting enough or aren't getting optimal amounts. Interesting fun fact about mushrooms is that if you put your mushrooms in the window and let them get some sunlight before you consume them, that actually increases their vitamin D content. And then in terms of recipes, you can kind of see here, we have our easy salmon Florentine. So salmon baked with mushrooms. So we have our fatty fish and we have our mushrooms in a cream-based sauce. You can use your fortified milk there, and that will get you a little boost of vitamin D. But like I said, sunlight really is the best source of vitamin D. So going outside and spending time outdoors is going to be your best bet there. Okay, zinc. There's a lot of research going on with zinc too. Um, zinc is a really good immune support. So even when you have things like colds or the flu or things like that, zinc can be really helpful. And that also translates to things like COVID-19. What it does is it upregulates the immune system so that, again, if you are to come in contact with the virus and you are to become infected, zinc will make sure that your immune system is kind of all systems go, and making sure that um, you can mitigate the effects of viral replication as much as possible, and even decrease viral replication, decrease of the virus's ability to replicate itself in the body. Foods that are high in zinc, oysters are kind of the famously high zinc food, but you can see that there's lots of other options. A lot of them are going to be animal based, things like meat products, eggs. And an easy Again, a pretty easy recipe that will get you a decent amount of zinc is going to be something like a fajita salad. You know, that beef is going to have, um, you can see here, going to be an excellent source of zinc. And then pairing it with the vegetables, you know, I always tell my students that my rule of thumb is that half your plate at every meal should be vegetables, and kind of um, see how often we kind of miss that mark just out of habit or out of culture, making sure that you're eating plenty of vegetables and getting all the supportive vitamins and minerals um, as well. Because vitamins, you know, I'm talking about specific vitamins and minerals in this presentation, but no vitamin, no nutrient is an island, right? And so they're all going to kind of work together, and you need to make sure that we have all the supporting players as well. All right, and then our last nutrient is going to be resveratrol. And we hear about this all the time when it comes to heart health, right? That's why we get to drink our wine at dinner time or whenever you choose. Why it matters when it comes to COVID is that it's going to block ACE receptors. So just like vitamin D, it blocks the receptors that bind to COVID. And so if the viral particles don't have anywhere to go, they're not going to be able to cause any problems in your body. It is also a really excellent antioxidant, and making sure that any negative effects are mitigated as much as possible. It's going to decrease that cytokine storm, you know, block replication. You can kind of see another really special side effect of resveratrol, and you know, this pertains to kind of its heart health function, is that it keeps our vessels safe and prevents clotting. That's one of the long-term effects that we're seeing in people that are getting people into trouble, is you become more prone to clotting after you've become infected. And so making sure that you have your clotting factors in check and things like that is going to be really important. And resveratrol is one compound that can do that. Okay, so where to find it? Like I said, it's wine is kind of the infamous source, but remember we talked earlier in the glutathione section that alcohol is generally not the best way to get your nutrients. There's going to be more optimal options to get what you need. Things like dark colored grapes, black grapes, or red grapes are going to have plenty of resveratrol. Things like peanuts, lingonberries or cranberries, blueberries, things especially with really dark outer coverings are going to be higher in resveratrol. And so your recipe for this guy is these blueberry pistachio power bites. And these are kind of a really simple snack that you kind of can make, and a great meal prep option. The recipe wasn't exactly what I was looking for, so I kind of added some swaps for you. It uses almond butter, but if you swap in peanut butter, that's going to increase the resveratrol content. But it has pistachios in it. Oh, they're not on my graphic, but pistachios are also a really high resveratrol food. And then also the blueberries. And dark chocolate is also a high resveratrol food. And I feel like anytime we can highlight the benefits of dark chocolate is that's something notable, something we should take note of, right? My rule of thumb for chocolate is I like it to be 75% cacao or more to kind of optimize those health benefits. Lower than that, and you start to dilute the benefits, and you're likely adding a little more either milk or a little more sugar or a little more something. That isn't quite where we want to go. And then this is kind of an overview of what we talked about. There are kind of three lines of defense when it comes to food and when it comes to supporting someone in COVID-19. And the first line of defense is going to be blocking, right? We talked about that with vitamin D. We talked about that with resveratrol. Um, in order to prevent the viral particles from even getting into you in the first place. You can kind of see that's where resveratrol, that's where the vitamin D kind of enters. And then should that defense fall, we have our second line of defense, right? It's always good, just like in football or whatever, to have your lines of defense so that your opponent can't get through. And that is your antioxidant supports. Things like selenium, which is also going to be a precursor to glutathione, and I kind of put it in NAC and glutathione here. Astaxanthin is also a really big antioxidant, and those are going to kind of mop up the mess caused by viral particles replicating. It's going to decrease inflammation, kind of try to keep that cytokine storm in check, and so that's going to be really important there. And then our third line of defense is going to be to optimize immunity. And so here we're making sure that, the viral particles have gotten in, they're kind of doing a little bit of damage. And so we want to make sure that kind of our immune troops are on the ground and hitting the ground running. Things like our zinc and vitamin C, our curcumin is kind of mopping up and ramping up all of our T cells and B cells and all our antibodies to make sure that everyone's on board to kind of keep things as low as possible and to mitigate side effects and clinical presentation as much as possible. And that's what I have for you guys. I want to turn it over to Stacy, and then I think we can take some questions at the end.
Okay, just looking here to make sure I can, I don't know how to. All right, Desta, I don't know how to unshare your screen. There we go. Okay. Desta had great slides. I do not have slides for you today, but I enjoyed her presentation so much because there's just so much that we can do for ourselves. And I think over the last year, the biggest take home message is, you have control over your health and your life. Things feel really out of control. And so I just really appreciated what she shared, because it shows you that we can use food as medicine and as preventative health and really sort of mitigate some of the potential stressors or long-term effects of COVID or even other viruses. I'm a dietitian in the Winchester area, and for the last 6 years, I've primarily worked with people who have autoimmune disease. And a lot of that is triggered by viruses, not just COVID, but other viruses. So I see that a lot. But it can be triggered by a lot of different things. So this is kind of the background I come from, but I wanted to share that with you because a little caveat, I'm not a doctor, I'm not a vaccine researcher, and I can't tell you whether or not you should get the vaccine, but Stacy wanted me to talk to some of the research I've shared with her about the risk factors related to COVID and the efficacy or how effective vaccines are for certain populations. So that's what I'm going to share with you today. I'm going to share some of that research with you, as well as other ways that you can boost your immune system that to kind of build on what Desta shared, and how to also boost that effectiveness of the vaccine if you should choose to get it. So one of the things that we have seen in the last year is that a BMI, a high BMI, is positively correlated with the severity of COVID. So we've seen that obese individuals are at greater risk for severe COVID or even death. Okay, and that's just the reality of what we've seen. Let's think about why that's the case. Oftentimes with obese individuals, there come other health conditions. You're going to see low-grade inflammation in most of those individuals. You may have reduced lung capacity. You may have high blood pressure, diabetes. Oftentimes with obesity, we also see insulin resistance that can make the disease worse. And interestingly enough, adipose tissue or fat acts as a reservoir for the virus. So it's another factor that we're dealing with when it comes to obesity. And then we've got the gut health, which is also a factor here. Now, gut health, you can be any size and have a lack of diversity or have poor gut health. So that's not necessarily an isolated factor. And none of those are isolated to just obese individuals. We have what we call skinny fat, where you may be thin, but you may still have a lot of these chronic conditions that are going to increase the severity and risk that you have associated with the virus. And reduce the efficacy of the vaccine. But in many cases, these things come together. And so that's what we're going to look at. So in both the disease state and in the case of the vaccine, it's really thought that inflammation and a dulled immune response in obese people can decrease the effectiveness of it. Now, we all know that we're part of the bigger experiment with the vaccine. I mean, it it hasn't been out very long. Most pharmaceuticals have to be tested over many, many years. And so there's a lot of unknowns when it comes to the vaccines. And I would say, for the most part, the verdict is still out when it comes to how obesity factors into the effectiveness of each one. We're really just starting to see that data now after several months. But what we do know is that prior studies of vaccinations for flu, for Hep B, for rabies, those vaccines were less effective in those who are obese. And we've seen that for many years, for decades, in the flu vaccine. So we already had that data to build on. And then as recently as February, we looked at obese healthcare workers who showed decreased antibody levels after they took the vaccine, which basically means it's not working as well as it could. Okay, so whether we're looking at COVID, the disease, or the COVID vaccine, the bottom line is that obese people are generally going to be more exhausted at the start of that infection or at the time of the vaccine, which is ultimately going to compromise your immune system and maybe have it not work as well, or maybe have a more severe case of the disease. Okay, so I say that all so that you have a good understanding of where I'm coming from, because the good news is that diet and exercise can really, be beneficial when it comes to this. And a holistic approach to your health can actually improve your health markers, improve all of those conditions I mentioned earlier that are associated with obesity, and also decrease weight. So I wanted to share with you some of the things that I do. I really tend to avoid quick fix solutions that give you only temporary weight loss, because those are often not really sustainable and won't give you the long-term health benefits that we're after. Remember, I mean, the scale is a number, but it's what that comes with that we're really concerned about. It's the health markers around that BMI that we're concerned about. Okay, it's not necessarily just BMI. So the strategies that I use with my clients for effective weight loss are what I want to run through today. I want to share with you some of the strategies I use. As a dietitian and a health coach, I tend to work with both individuals and in a group setting. I do a lot of virtual counseling, almost all virtual counseling at this point. And so when I have somebody who comes to me and says that, I want to lose weight, and I also have IBS, and I also have a lot of joint pain, and maybe I have other symptoms of inflammation. These are the things that I'm going to recommend we start with to sort of lay that foundation. I always say that good health is like a tabletop. You have 4 legs, right? You have exercise, nutrition, stress management, and sleep. And if one of those is shorter than the other, your table is going to be wobbly. Now, it's a lot of work to get all of these legs the right length, right? But this gives us a goal. This gives us something to work towards. So the first strategy that I would recommend, or that I do recommend to most of my clients, is starting with intermittent fasting. Now, there's a lot of research on intermittent fasting and the benefits of it. The benefits as related to the vaccine and the COVID would be that it helps to improve your insulin sensitivity. It helps to improve your overall gut health and digestion. It definitely decreases inflammation, and it often leads to quick weight loss and will help decrease overall BMI. So there's different ways to do intermittent fasting. Primarily, I focus on like a 16-8. So we would do a 16-hour fast and then condense our food into an 8-hour feeding window. Now, depending on your conditions, depending on your health history, I may shorten that fasting window just to support your adrenals and your thyroid. You may go closer to 12 or 14 hours. But at minimum, everybody should be fasting for 12 hours overnight. So I recommend that's a great starting place. We don't want to be eating up until bedtime necessarily. So we want to give ourselves a little bit of a break before bed, and then wake up in the morning, and somewhere around 12 to 14 hours is a great place to start. And that just means, no food, no calories. We really just focus on water. And that gives your body a chance to decrease inflammation. It gives your body to be at a chance to be at digestive rest, which will improve your digestion. And you won't be producing insulin as often, which also will improve your insulin sensitivity. Now, I won't get too much into that, but insulin is a fat storage hormone. So we produce that whenever we eat. So if we're eating constantly and frequently, we're producing a lot of insulin, and that's basically signaling to our bodies to hang on to fat. That's kind of the simplified version of that. So when we give ourselves more time without that insulin production, it's going to improve our sensitivity when we do produce it. Okay, so we start with intermittent fasting, and people love that because it's so much easier than they think, and the results are pretty quick. I mean, we see that pretty quickly. It's not a diet, it's just an eating schedule. So that's one of those kind of low-hanging fruits, the thing that you can start with. Of course, I'm a very holistic practitioner, so I'm always going to recommend whole foods, limited processed foods. We really want to focus on foods that, if they come from the ground or have a mother, we want to focus on those foods. Okay. So what that does for us is it decreases our inflammation. You see a pattern here. I'm really looking at ways we can decrease our inflammation to improve our immune health. Well, we're going to decrease our inflammation because we're not going to be giving it junk. And, we're going to be avoiding a lot of man-made synthetic chemicals. We're going to improve our glucose control. And we're going to improve our gut health in doing that. And then we get all those micronutrients, a lot of what Desta talked about, looking at those whole foods where we get micronutrients from, where we get that. My favorite vitamin is vitamin D also. So, where we get those things, we're going to be getting from our food, and of course the sun for vitamin D. Okay, so we really want to focus on those whole foods. And along with that, I tend to work with people a lot on finding the right balance of foods. And when I talk about balance, we hear a lot about low carb diets, especially keto, really focused on low carb, high fat, or high protein. Sometimes it gets really confusing about how to manage that. And so I look at it from a balance perspective of how do we balance macronutrients, and our macronutrients are protein, fat, and carbohydrates. We want to eat those in balance for that improved glucose control and insulin sensitivity. Now, again, there's a theme here. Elevated blood glucose, diabetes, prediabetes, these are all inflammatory conditions. And this also helps us to manage that insulin, that is that fat storage hormone. Insulin's good for things. I'm not saying it's a bad hormone. I'm just saying we need to manage it. So that's going to help us with that blood glucose control. It's going to give us more energy. It's going to help improve our hormones, give us those improvements there, and just that overall balance that we need. Okay. And then finally, I also focus on exercise. So we focus a lot on nutrition, but exercise is a component of this. It's recommended that we aim for 150 minutes of activity a week. So when you break that down, that might be 30 minutes, 5 days a week. You don't have to, sweat it out in the gym for 2 hours a day. That's not necessary. What we need is just daily movement. We need lifestyle movement that involves being more active in everything we do. Like I'm standing, I have a standing desk. And so I'm using my hands, which I which I do a lot too, but we're talking about increased activity throughout the day in addition to some exercise. And that also helps to decrease our inflammation. Muscle actually helps to boost your immune system, and it will help you burn more fat. So we want that extra muscle. We want to be lifting weights or doing some strength training or resistance training. It also helps to decrease your blood pressure and again, improvements in glucose control. Okay, so you see how all of these things work together to address those conditions that really put us at greater risk for severe COVID and also at, having a less effective vaccine. Each of these strategies on their own can improve your health, support your immune system, and help promote weight loss. Okay, so, just taking one of these and starting there is a great, great next step. Now, when we do all of these things, that's going to give us optimal results. And, we get there. That doesn't happen on day one when you're starting to make changes. But if you just pick one of those things to start with, you will start to see results. Okay. And what we want to do is support that immune system, reduce the overall inflammation, and then, hopefully see that reduction in obese or, in your BMI and your overall weight. Okay. So typically, once you start making changes, based on the results of my individuals and my group program, I usually see people. People usually see changes within 2 to 4 weeks of starting this. Okay, so we would see decreased inflammation, improved gut health, better sleep, more energy. We would start really seeing some of those, what we call non-scale victories, those things that are happening off of the scale. And then at about 6 to 8 weeks is when we really start to see those changes in weight and body composition. We start to see improvements in your hormonal profile. So if you were to get that checked, you would probably see improvements in your labs. Also your glucose control and your A1C. So if you are diabetic, you would, after 6 to 8 weeks, you would want to get that rechecked. Well, it's about it's a 3-month window for the A1C, but you'll start to see improvements there if you make any of these changes. So again, I just want to share with you some of those strategies that I have to help make this maybe a time where you can take a little bit more control over your health and the outcomes of this time that we have. And I'm absolutely happy to answer any questions.
So any questions for Desta or Stacy? Maybe I'll start. I'll just ask for Desta, you mentioned all of these great, vitamins and minerals we should be consuming as a prevention. What happens if you get COVID? Still take all of those things? Like, what's the strategy there?
Yeah, so that's the thing with nutrients is that um, it's great for prevention, which is obviously the ideal, right? But even once you get COVID, things like NAC, vitamin C, there's tons of research on those types of things, zinc, and limiting the course of the disease. So less severity, shorter hospitalization, not as long as in the ICU, less likely to need a ventilator. All of those things are good relatively, right? um, and so those things can absolutely be helpful. And like I said, nutrition and lifestyle kind of base changes, like Stacey was talking about, this is a long game, right? So it's not like you are taking your vitamin C today and tomorrow you are healthy. Like that's not how our bodies work, right? And especially if you're deficient in any of these nutrients, you have to get to a baseline level before you can see the therapeutic levels, right? And so we're playing the long game. We're, kind of investing in these things now so that we see a return on investment later in improved health or less severity when we do experience sickness. And like Stacey said, this isn't nothing either of us talked about today is exclusive to COVID or coronavirus. It certainly helps, and it can be a huge boost to people who need it and experience it, but it's also going to be a huge boost to heart disease, the leading cause of death in the United States, to diabetes, the leading cause of heart disease, to cancer, which can be a super scary diagnosis for a lot of people, right? And so really, like, all of these recommendations, all of these thoughts are win-win. Like, we're thinking about COVID now, but in a couple years we're not going to be thinking about that anymore, hopefully, right? We're going to be thinking about our heart attacks again, and we're going to be thinking about our cancer diagnosis, and you'll have already set the stage to kind of minimize that as much as possible.
I had a question. So I was trying my best to take notes, but I wanted to see more of like the food recommendations that are high in some of the supplements you were talking about. Um, I know one of them you mentioned it was like a lot of like animals. So what? So I am a vegetarian, and I don't eat a lot of cheat dairy. Actually, I try to avoid dairy. It just doesn't agree with my stomach. So how like do you guys have recommendations for like diet, I know Stacy had mentioned like IBS. So, I struggle with that as well. Um, so I'm just a lot of the foods I do eat, like you specifically said yellow bell peppers, and I love bell peppers. But I was just wondering if you had any advice. And I also have a 13-year-old, and she's also a vegetarian. So I worry about making sure she gets all of the good stuff that she needs, growing up.
Yeah, sure. I'm sure Stacy has something to add here too, but there's there's plenty of plant-based options in nuts and seeds that can be incorporated for any of the nutrients that I talked about. Um, my my plug for anyone that is on a plant-based diet is, like Stacy mentioned, to focus on whole foods. When we can get wrapped up really easily in trying to substitute plant-based products for animal-based foods like the Beyond Meat or Impossible Burgers or whatever. And those things are kind of vegetarian junk foods, right? They're not whole foods. They're going to be pretty highly processed. And so when you're focusing on your produce, when you're focusing on things that come from the dirt, right? Like Stacy mentioned, is where you're going to see the most benefits. And when you are buying a lot of the prepackaged vegetarian options, you're going to see more of those inflammatory things come into play. And I'm sure Stacy has more to add there.
No, I mean, you pretty much, that's exactly what I would say is I do think vegetarians in general, or vegans really have to, um, I think they have a hard job in a way because I think you have to really think through how are you going to make sure you get those nutrients in, because it's so easy to rely on some of those processed foods that will be kind of anti-nutrient. And so I would say just keep it whole foods. Protein wise, it is a little bit trickier. And some people eat soy, some people don't, but you want to make sure you go with like an organic, non-GMO soy product like tofu or miso. Or edamame, but nothing, I would really recommend staying away from any of the processed tofurkey kind of or Beyond Meat kind of thing. But I'm not sure if I don't know if I am answering your question. If you're looking for the foods that have all the nutrients that Desta mentioned, I think if you think about it as a rainbow, if you're eating that rainbow variety of foods, you will be getting those nutrients in. I mean, that's really what we want to go for is a variety of foods. I think in one of Michael Pollan's books, he cited the research that says, 2/3 of our calories come from just 4 foods. They come from wheat, rice, soy, and corn. So if you think about 2 of your 3 meals are only those, and they're very, I would say they're not nutrient dense foods. So you've only got 1 meal to get in all of your nutrients from the rainbow. You've got 1 meal to get in all of those vegetables and fiber and healthy fats. So what we really need to do is look at eating fewer of those 4 foods and expanding our variety to all of the other plant-based foods out there.
I've gotten really good at tricking my kid to eat mushrooms. I just want y'all to know. Well, she likes all the stuff that you want to avoid. I mean, she's 13, so she likes the fake burgers and all that. So that's a special treat. But I typically like shopping in the outside of the grocery store just because I don't know. I learned that somewhere. But thank you for the information today, Stacy. Will we be able to get a copy of this PowerPoint?
I'll send it to Stacy as a handout, and then you guys can have access to it.
Yeah.
Thank you. I appreciate that.
I had a quick question, I think probably for Stacy. So you talk about like the fasting, the probably 16 hours fasting, 8 hours of eating. And so I was just curious, do you recommend individuals eat like 6 small meals a day or stick to like your 3 larger meals a day? Like what's kind of the breakdown, or maybe that's more than this is talking about, but I was just curious.
Well, with fasting, I really don't recommend that you skip meals because what happens with chronic undereating is, again, stress, inflammation. We don't see that support. We have to look at food as fuel. And so a lot of people think of intermittent fasting as, okay, I'm going to skip breakfast and I'm just going to have lunch and dinner. And then when you do that over so long, you really feel worn down. Now, some people may not find that's true if they eat large enough meals, but most of us are going to need at least 3 meals in order to get enough food to fuel our bodies and to get those nutrients that we need. So, I think however many meals works for your schedule is fine. Some people prefer smaller meals. I like to give myself a good 3 to 4 hours between each meal to allow for full digestion. And I do think that helps with digestion. Personally, but, from many of the clients I've worked with, they've done better when they aren't eating constantly, when they're allowing for that full digestion. But I also have some clients who just really prefer to eat smaller meals. And so that would kind of be more individual, but you want to make sure you're eating. That's the important thing.
Great, thank you.
I'm going to ask, so maybe because I've been working with Stacy, macronutrients, can you just give us a little more glimpse into what that looks like and, why fats are important, for example, and that sort of thing, the balance of all?
Yeah. Well, so again, going back to what are macronutrients, our macronutrients are protein, fat, and our carbohydrates. So they're really the building blocks of everything that's going on in our body. The micronutrients are sort of the fine tuning. They fine tune everything, but your body is going to primarily use carbohydrates as fuel. When it runs out of carbs or sugar, it's going to dip into fat stores and use fat as fuel. And then its third source of fuel is protein. We don't really want to use protein as fuel because you end up with some muscle wasting at that point. So we really want to use our carbs and our fat as fuel. Now, we don't want to be eating high carbs and high fat at the same time because we won't be able to get through all of our carbs to burn the fat, right? That's why that lower carb diet, higher fat works so well for weight loss. On the flip side of that is that sometimes that can be, as I mentioned, a little bit taxing on the thyroid and the adrenals, which, our hormones need carbs and healthy fat. Okay, so when you're going to do higher carbs or moderate carbs, you're going to want to eat slightly lower fat. I tend to look at protein as that one thing that stays the same that we need a lot of. Usually for vegetarians, I would recommend at least 20% of your calories come from protein. But preferably I'd like to see 25% of your food being protein. So that means protein at every meal. And protein is going to help you feel full. It's going to help you feel satisfied. Your fats are going to do the same. So you want those with every meal, right? And then your carbs are also not bad. Carbs are not evil. They do help our bodies. But it's just a matter of how to balance that with the fat intake and make sure that you're not overeating. So I just recommend that we get protein, fat, and carbs in every single meal, starting with breakfast. Make sure you get protein and fat with that meal to help you, be sustained through the day. But I could talk a long time about that. So if I didn't answer your question,
You
let
did.
me know.
I was just guiding a little bit. Thank you. Anybody else? Well, if there are no other questions, I just want to thank Desta and Stacy for joining us. Chris will have the recording, and I'll send it out, and we'll send out the contact information for Stacy and Desta, as well as the slides. So just encourage you all to make those good choices every day, and maybe it's just a few to start with. But again, thank you so much, Stacy and Desta, for taking your time to join us.
You're welcome.
Thanks for coming, everyone.